for some time. We heard Governor Newsom talk about a framework and some of the steps to open up our society and our economy in the days and weeks ahead. What I liked about what I heard was how it allows folks in counties to do what makes sense in their region, to make sure that we develop the metrics that are important to us, to track this virus where we live and where we are, and to take forward steps to give us all hope that where we live today is indeed not our final destination, even as we accept that life will be changed for some time. We know these steps are important, as is assessing each one of those steps. And my promise to each and every one of you is that we will continue to be guided by, first, the medical advice we get from public health professionals. Second, by making sure that we are not just saving lives, but thinking about people's livelihoods as well. And that third, we will always share all of our decision-making and all of our data with you. As soon as I get it, it is yours. These are the three things that have allowed us to make such progress in these past few weeks, that have allowed us to save lives, and that have prepared us for the days that are ahead. But I want to prepare you, these won't be easy days, and they won't be normal days, and we won't be rushing back to something we once knew for some time. But I have deep faith in the reservoir of generosity, in the strength of the discipline that you have shown, in the hard work ethic that is Los Angeles, and the creativity and the love that surrounds us every single day. LA County has saved countless lives, and our death rate is lower than the national average thanks to what you have done. But we nevertheless have suffered about half of the state's COVID-19 related deaths. And our timing on opening may vary from other parts of the state. We're a very diverse California, from very densely populated urban environments to sparsely populated areas where the density is much lower and where there's much more outdoor and open space. So it's important that when we hear the governor, no, he isn't talking to all of us in exactly the same way. He's brought together a framework that then requires us to do the hard work here to determine what's right for Los Angeles, just as other counties are determining that for the places that they live as well. So in the coming days, together with my fellow mayors and council members in cities across Los Angeles County, led by our Board of Supervisors and our public health departments, we will make these decisions together. We will ensure that we are marching all on the same line. We're hard at work right now detailing what will reopen, and perhaps just as important as what, how we will reopen. And I've always promised to tell you the good news and the hard truths together. It's been the hallmark of our communication, is that there is good news each night and also sad and tough truths to face. And I will reopen our city with careful consideration, guided by the advice of public health professionals. And what we should all ready ourselves for is a new normal, no matter what is open or closed. Even as things may reopen in certain areas in the coming weeks, we still need to practice physical distancing. Even as our gathering places reopen, we still need to wear face coverings when prescribed. And all of us have to do our work to save lives, because with new freedoms will come new responsibilities as well. And I'm here to lift up our hopes. And I hope that the news of a phased reopening does just that. We've been thirsty for that for I know so many days and weeks and now months. But I'm also here to share those hard truths that I mentioned. And I want you to listen carefully and hear me when I say it's going to be tough for a while. This is hard. This hurts. But this is our new normal. We've arrived at this place where we can even talk about what we will open because of you, because of the sacrifices you have made. This isn't the leadership out of a mayor or a board of supervisors or government. It is the collective 10 million of us here in Los Angeles County that have led. Every single time you've made a good decision, every single time you've stayed at home, every single time you've worn the proper face covering, every single time you've used discretion instead of aggression as the way that we move forward. And the sacrifices you have made and the steps we will take forward and back, because it will be sometimes steps forward and sometimes steps back depending on where this virus is. They will depend on you, on each one of us. And we can only move forward together, because there's one thing I've learned about this virus. It thrives on division. This virus exploits division. But when we are unified, we can beat this virus, and we have to keep that unity marching forward. We'll make missteps. It'll take 2, 3, 4 weeks sometimes when we take steps and realize that infections have gone up. But we'll learn, we'll get smarter, and as we always have, we will take swift action to save lives and to correct our course. And if we're committed to that together, I have tremendous confidence in the weeks and months ahead. We'll move forward faster by listening to scientists and heeding data, not by inviting ignorance, but by following the facts. So let's start with tonight's facts, as I always do, and give you your data snapshot. Today, the county reported 568 new positive diagnosed COVID-19 cases, bringing the total to 26,217 cases. This is a 2% increase since yesterday. For comparison, the past 7 days have seen an average daily increase of 854 new cases. Here in the city, those numbers are 225 new cases, 12,525 total, also a 2% increase since yesterday. And today in the county, we learned about 28 additional deaths. This brings our total to 1,256 loved ones that we have lost since this began here in Los Angeles County. That's a 2% increase, and the past 7 days have seen an average 46 people dying or being confirmed as having died each day. And we still mourn with each family and community grieving a loss. Across the county, our hospital system remains resilient and strong. 1,276 available beds, 235 ICU beds in that mix, and an inventory of 1,113 available ventilators. This is a key measure moving forward. Any nights where you see those numbers come down is a night we have to assess where we're at. But nights where that holds means our work is continuing, and it's good work moving forward. There are currently 1,819 of our fellow residents who are suffering from COVID-19 that are admitted into hospitals. And there have been 5,019 admitted since this crisis began. That's 139 net new. Some people left, some people came in, but 139 net new since Friday. And today we have the capacity to test 18,500 people. It's an amazing number considering where we started. And by the end of today, we will have tested just under 200,000 people, 194,000 to be exact. And tonight I can announce the opening of 2 additional testing sites, one at Northridge Fashion Center and another at Baldwin Hills Crenshaw Plaza. This is our 4th site in the San Fernando Valley, our 5th site in South LA. Drive-through testing will begin in both locations starting on Wednesday, and appointment signups are open right now. And I'm also glad to announce that beginning on Wednesday, we will extend the testing hours that we have to deal with the capacity and the convenience of these sites. Each of these sites will now be testing through 5 p.m. to allow more people to be tested each day. And as always, we're so grateful to Los Angeles Fire Department men and women and our partners at CORE for helping get these new sites up and running. They've become a national model, now visiting cities across the nation to help them stand up testing centers as well. And every week we are growing this testing capacity and the data to be meaningful and helpful. And for the data to be meaningful and helpful, we need to make sure every slot is filled. So sign up, get tested at coronavirus.lacity.org/testing, or call us at 213-978-1028 business hours or 311 after 5 p.m. I cannot overstate the work we need to continue to do to strengthen testing at our skilled nursing facilities. These facilities are home to people who are at increased risk of COVID-19 severe symptoms and possibly dying. And 40% of deaths statewide have occurred at nursing homes. When we talk about stopping the spread, when we talk about saving lives, that challenge is greatest at these nursing facilities. And it is among the highest priorities for our Department of Public Health at the county. We've addressed this head on by surging teams starting with 1, then 3, now 6 mobile testing teams that can surge in. And on top of that, we've mandated, first city in the country, that facilities provide free monthly testing for their residents and their workforce. Since April 8th, the city has tested over 7,100 residents and staff of skilled nursing facilities. And our mobile teams plan to visit every single skilled nursing facility in the city to make sure testing is available. But this only works if people living and working in these facilities know how, where, and when testing is available to them. So tonight, I'm updating my April 24th order, and effective immediately, all skilled nursing facilities in the city of Los Angeles are required to hand deliver notices to all residents and workers, which include the last date testing was offered and the next date that it will be offered. We've seen heartbreaking stories in the news. We know relatives and others that have wanted tests. These notices will ensure that they happen, and they must be updated and circulated once a month and at least 2 days prior to when testing will be next provided. And an up-to-date notice must be publicly displayed at the main entrance of every facility and provided to anyone in the media, the government, or the public who asks for it. Our residents deserve nothing less. This order will provide important accountability and potentially life-changing, life-saving resources as we continue to navigate this health emergency together. You see, since day one, we have always acted to protect those in our city who are the most vulnerable. Whether it's our seniors, whether it's people experiencing homelessness, whether it's frontline healthcare workers, people in our grocery stores and driving our cars, we've made sure that they and first responders have the access to the protection that they need. For those who are experiencing homelessness, it's a particularly vulnerable population that often has underlying health conditions that also make them, just like seniors, vulnerable to severe symptoms and death. We've opened up 24 now temporary shelters at rec centers across Los Angeles. They're currently at 87% capacity, and I know I had a question about folks who want to get in, who are demanding more beds. Beds are available right now for folks who need to get in, and calling 211 is the best way to access those. We have 900 people safe and healthy in those, and we've also partnered with our city's hospitality sector to bring vulnerable people off the streets through Project Roomkey, a partnership through the state and the county, the city of LA, and cities across Los Angeles County. This helps give badly needed revenue to our hotels and motels, puts people back to work while protecting the lives of those people experiencing homelessness and saving the lives of all of us by ensuring spread of COVID-19 slows down. Over the weekend, the county secured an additional 505 motel rooms, a huge 25% boost, bringing our total to 2,711 rooms countywide. And thank you for that critical work, Los Angeles County. And tonight, I can announce that the city has secured a large hotel downtown, in the heart of downtown, delivering more than 460 new rooms, which increases our total to more than 3,000 hotel and motel rooms as part of Project Roomkey. And it's also expected to bring more than 100 people back to work. This is a win-win-win for everybody, for public health, for our fight against homelessness, and for workers who are out of work. Because this is our first large downtown hotel, and because it's closer to the epicenter of our homeless crisis in Skid Row, it will boost our efforts to support Angelenos who are at the greatest risk of dying from this virus. And even though this first downtown hotel represents big progress towards housing more Angelenos, we are continuing to look for others. As I mentioned on Friday, over 800 hotels we've called to date. But keep in mind, many of the newer world-class hotels nearby are very expensive. We don't want to overspend taxpayer dollars. We wouldn't be able to bring in as many people off the street from our city into rooms. So by finding the most affordable hotels we can and being fiscally responsible, we can continue helping the largest number of people who are experiencing homelessness and hopefully putting those days behind them. Each hotel brings new hope. Each room could save a life. And hotel and motel operators are ambassadors of the Angeleno spirit. So if you want to step up and help, please let us know and go to coronavirus.lacity.org/rooms. We're saving lives by supporting our most vulnerable neighbors. A clear example of that is how we're feeding our seniors, those who are homebound and can't cook or get meals for themselves. We've already scaled from 5,000 to 12,000 seniors and doubled the number of meals per senior, going from 25,000 to 120,000 meals home delivered each week. This past Friday, we, through a state and FEMA program, kicked off a greater expansion of senior meals here in Los Angeles. We called it the second phase of our senior meal emergency response, and we expanded to 3,000 more seniors to date, partnering with the Hospitality Training Academy, which is working with 4 hotels and hospitality kitchens that have hired back now 106 workers who didn't have a paycheck, as well as 3 taxi cab companies, LA Yellow Cab, United Checker Cab, and Bell Cab, with 50 drivers. We've put more than 200 people back to work. So if you are in need of a home delivered meal and you're 65 or over, or 60 to 64 with an underlying medical condition, and you're not already enrolled in another meal program, call us, please, at 213-263-5226, or you can go online to coronavirus.lacity.org/senior meals. We have folks ready to answer your call between 9 and 5, and the internet is 24 hours. We will also be partnering with restaurants as demand for meals increases. So if you're a restaurant that's ready to step up and help meet this need, go to the same website, coronavirus.lacity.org/senior meals. I think I said meals, it's /senior meals, and sign up. We want to get your restaurant back in business and your workers back to work. Whether it's seniors or whether it's Angelenos experiencing homelessness, we are focused on protecting the people who are hardest hit by this crisis while we protect everybody. Meeting that mission also means supporting the working families who may have one missed paycheck away from eviction before COVID-19 and now face an unprecedented threat to their health and their economic security. Having just passed the first of the month, I want to again encourage renters to notify your landlords if you're unable to make rent because of the impact of this novel coronavirus. The state recommends that you make this notification within 7 days after the due date. And while our city, and also it's important to remember, our city does not compel anyone to provide this notice or documentation, but we do strongly urge you to do that as soon as possible. And for us, the most important step to communicate with your landlords is making sure that they and you are talking, making sure that we never forget the only way to endure this tough moment is by working together. And there are resources available for you at our housing website. That's at hcidla.lacity.org. And we continue to support national legislation to help both mortgage payments and rental payments be forgiven. That is a priority that I hope this Congress will adopt and our president will sign in the next round of CARES Act. For families and households across our city, throughout our country, and around the world, this outbreak has forced us out of our usual routines. We're still feeling topsy-turvy. We're feeling like our worlds are upside down. It's altered how we socialize and interact, stay in touch with grandparents, or practice our faith. It's led us to seek new ways to interact, engage, and communicate. For kids and for students and their parents, that's meant learning a new vocabulary about distance learning and Zoom classrooms, breakout sessions, and more. For teachers, you've had to come up with a brand new approach to education, mostly on the fly and with no notice. And as we enter Teacher Appreciation Week, I hope all of us take a moment to recognize the immense work and effort that goes into teaching our children in these trying circumstances and say thank you to our teachers. Thank you for stepping up to this moment. Thank you for giving your heart to our children. And thank you for using your heads about ways we will get through this without our children falling behind. If you're a student, think about what it takes for your teachers to plan those lessons, pay for the supplies out of their own pockets, and go the extra mile to be available to answer questions, tutoring, anything you need. For parents, we'll never ask, what do teachers actually do? We've experienced how tough these jobs are and also how important they are. And for all of us, let's think about how much time and love the teachers pour into their profession, their calling, and consider how they're going above and beyond the call by doing it all without their normal environment, yet with the same energy and effort each day. So let's thank a teacher this week. Let's show our kids and ourselves what will be required to return to the classrooms and school houses in the months ahead by the behavior we have, by staying healthy and staying safe, and by staying at home. Better days are ahead, and we will get through this together with strength and with love, Los Angeles. Thank you as always. And with that, I'm happy to answer your questions. Thank you. I'll take the first question.
First, we turn to the line of Kevin Rector with LA Times. Please go ahead.
Hi, Kevin.
Hi, sir. You joined more than a dozen other mayors in the Giffords organization on Friday to ask Congress for more federal funding to fight crime and support violence interrupters. Is that to backfill cuts in your budget for such gang intervention work? And how much are you looking for?
No, we're not looking to backfill, though we did have to make some cuts. We've always been looking for expanding some of the best, I believe, in country models that we have for gang reduction and youth development programs. Many of you know the story of how those started. Years ago, I was a council member and lost a young woman in my district who was walking with her boyfriend, a teenager who'd never been in any trouble, but somebody shot her in the back and killed her 2 blocks away from where a park had been open. Together with my predecessor, Mayor Villaraigosa, and I was president of the council, we started building ways to keep parks open in the summertime and now into the fall, how we could get former gang members and youth intervention specialists lined up to be able to get between, guns when there was escalation and intervene, and more importantly, also do the preventative work. So no, we just believe deeply that we know when we can stop gun violence, we can save lives. Before COVID-19, we saw this as obviously one of the toughest killers in our city. And while we see crime down at historic lows, go to certain neighborhoods and too many people still feel unsafe. But it is not to backfill. We made no cuts in the overall programs. We swept some dollars and said, you're gonna have to do that with less. But any new monies that we get allow us to go to new neighborhoods that are right on the cusp that could become much safer with this sort of intervention. I've always believed that, and ask any police officer, they agree, the best way to stop a bullet is with jobs and programs, not more policing. And when we can change those relationships between community and the police department, as we have with some of the best cases like our community safety partnership, which puts officers in a neighborhood for 5 years instead of just a year or two, we'd like to see that expand. So we're proud to be part of that coalition, proud to have a call for more money. We don't have, I don't think, a specific amount, but certainly here in Los Angeles, if you look at what we could spend, I think we probably have a half or a third of what we need in those programs. They've done a miraculous job, but we could always use more. Thanks for the question. Next question, please.
Next, we turn to the line of Claudia Pisciuta with KNX News Radio. Please go ahead.
Hi, Claudia. Happy Monday.
Hi. I have 2 questions.
Sure.
I'm wondering how long, on average, people who go to the city's testing sites are waiting for their results. You said part of your desire to expand the testing is to catch silent spreaders, but for that to work, you'd have to have a pretty quick turnaround. The second question is on Project Room Key. You were asked on Friday about the idea of commandeering hotel rooms and noted that the rooms that were then available were not filled, but I spoke with Heidi Marston today at LASA, who says the rooms are not going unfilled due to a lack of demand. There is definitely a huge demand. There are a lot of people still waiting for rooms. Part of it is just spacing it out to not overwhelm facilities or trying to find locations that are close to where people are actually living. So can you address those 2 issues? Thank you.
Sure, of course. Yeah, one, I completely agree with Heidi. It takes too long sometimes, but that's not the fault of very hard workers on the street who are trying to make those matches. But right now, that backlog isn't being slowed down, was my central point, by there not being enough beds. There's enough beds to meet that. We need to scale up both beds and shorten the time that people can get into them. And so that's why I was happy to share the news of nearly 1,000, well, a little bit over 1,000 new rooms just in the last 3 days since I spoke to you, which is, I think, an increase of nearly 50%. That's great news. It shows the pace is happening. And now with that, let's focus on getting people in there more quickly. In terms of the results, it's about 30 hours is average for the turnaround for testing right now. So it's pretty quick. I mean, in an ideal world, and that's not something the city can single-handedly do, obviously, but we've had a great relationship with the labs that we've been working and those are quick turnarounds nationally, some of the best in the nation. That doesn't mean everybody always gets 30 hours. It may take sometimes 2 days. Some people had early on gone longer, and occasionally you'll still get a case or two that, for whatever reason, gets lost someplace in the response, but we're good at tracking those down. And when people call us, please call the helpline if it's taken, more than 3 days. But no question, to your main point, and something I'd really like to continue working with our state and are working with our county on, is to make sure that we do have the tracking and tracing as well as the quick turnaround on testing. And it's not just how long does a test take to get the results back, it's also how quickly can we guarantee somebody can get into testing with symptoms. And we've met kind of what that national threshold is. People said within 24 hours. I'd like that to be down to 18 or even 12. Obviously, we have the testing centers closed from 5 now at night till 9 in the morning, so there might be more than 12 hours, but we should be able to turn that around quickly because we need to make sure we get them in there if they have symptoms. Secondly, be able to turn around. And as you mentioned, for people without symptoms who we are trying to track down, we also need that quick turnaround time, but it's about 30 hours on average right now. Thanks. Next question, please.
Next, we turn to the line of Alex Michelson with Fox 11 News.
Hey, Alex.
Go ahead.
How are you?
Hi, Mayor. Happy Monday. Hope you had a nice weekend.
Thank you. You too.
On the downtown hotel, which hotel are you talking about? And if you can't tell us, why can't you? And on the biggest, most important question of the day, are we looking at retail businesses opening up in Los Angeles on Friday for curbside delivery? Is that what you think is going to happen?
So I hope that tomorrow or Wednesday at the latest, that myself, a couple other mayors, as we remember on March 19th, stood together when we took the final action of the stay-at-home order. We announced that together with Catherine Barger, representing her incredible colleagues on the Board of Supervisors, each of them who's done a stellar job, Hilda Solis, Mark Ridley-Thomas, Sheila Kuehl, and Janice Hahn, that we stood there with Dr. Ferrer to announce that. I hope that we can go through how we will reopen, and then later in the week talk about what will reopen. Our order runs through the 15th. I'm listening very closely to Dr. Ferrer and others about how to do that safely. So just when the state opens that up, it doesn't mean that every place is ready or that has all of the regulations. But we've been busily working on those things together. So in terms of Friday curbside delivery, that is not my expectation this week, but that is very fluid. It is my expectation that by the 15th, we'll be able to take those steps forward. I hope that will be in places like retail and recreation, and we may be able to do that in some small areas even before next Friday. In terms of downtown hotel, I've been told not to say what the name is, obviously, so it can get up and running, help people get there, and to safeguard the privacy of the folks that are there. But if that changes, I'd be happy to share that with you in the future, but that's what I've been asked by the project. Next question, please.
Next, we turn to the line of Steve Gregory with KFI News. Please
Hey,
go
Steve.
ahead.
How's it going?
Mayor, good evening. Thank you. I'm well, thank you. I hope you're well. Are you concerned at all with the case number going up? And despite the fact that the governor's wanting to start to reopen some things and do a slow rollout, if you will, but are you worried at all as cases continue to rise that this could be a little too premature? I mean, do you support fully what the governor's doing? Secondly, I'm wondering if you're concerned at all, looking back at the timeline, with the sense of urgency of the release of inmates within the county and in the city of Los Angeles, and the urgency that happened when the same urgency did not apply for evacuating nursing homes and getting them into independent care or into the field hospitals and trying to sort of curb that as quickly as they did on the early release of inmates. Thank you.
Sure, let me take that first one first. I think the seniors and inmates are very different because they're best cared for actually where we have nurses. In these skilled nursing facilities, we wouldn't have had that level of care in any of the field hospitals or any place else, but it does concern me. Our senior nursing facilities, which is why I've talked about them so aggressively, put this order in place, revised it again today. In terms of inmates in general, it is extremely dangerous. We're seeing in the federal prison on Terminal Island, the largest outbreak in the federal system, at least percentage-wise. I think it was half of the inmates there, as well as deaths, have occurred. While it's not technically city land because it's owned by the federal government, that's right here in the Southland. And that was incredibly tragic to see. That said, I hope that we are doing these releases with some measure of maybe some options of where we can keep people who are particularly prolific incarcerated in a safer setting than the congregate jails. Because as we saw, some people are becoming these multiple offenders. 2 or 3 crimes in 2 or 3 days. I forget what the exact statistic, but if I remember correctly, it was something like over 10% of the crimes being caused by just 3% of the people who were released. That does trouble me. So I hope as we're learning things about COVID-19, how to respond better to public spaces, how to protect people, that we come up with some better solutions than just the mass de-incarceration. Though I do support that folks who are there for low-level crimes, nonviolent crimes, who we can still track and who can still come back to court and can still do their time or pay their penalties, we should not be killing them by keeping them in jails and prisons as we're seeing in other cities. So I think that's sound. In terms of the first, am I concerned about opening up? Absolutely. Every single day I'm concerned about opening up. That's what I stay up late, gnashing my teeth about, because the responsibility I have to this city and the moves that we make as a city within this county and as an example nationwide have human consequences. So what I like about what the governor has done is he hasn't said all of California must do this. He has said California can do this. Now it's up to counties to figure out where they're at. In Modoc, where they have 9,000 people, almost no cases, and a lot of space, not only can they probably move to where he's talking about on Friday, they may be able to qualify for phase 2.5 or whatever he called it today, which allows people to be self-certified by their county supervisors and their county public health officer to say that they can go even a little further. In a dense urban environment like Los Angeles, it's going to be different. And sometimes it will be slower, and I know that will be frustrating to people, but I just want people to know I'm never making those decisions based on anything political. I'm not making those decisions based on ignorance. I'm making those decisions based on advice from the people who are the medical professionals who tell us where we should move forward, or who advise us, if you want to try to go forward, this is how you can do it, we believe, in the safest possible manner. It's going to be a very imperfect science, but it's one that we can assess quickly if we're smart, learn from the mistakes or missteps, go further with the ones we do successfully, and I think we already have a pretty good record. Construction, early on, a lot of concerns. We've shown how to do that successfully without an outbreak in large numbers in the construction industry. That's a great example. Other parts of the country, other parts of the world, we've seen people make missteps, and boom, it goes right back up. And I'd remind people, what we saw in some place like New York can still be LA in a matter of just a few weeks if we do this wrong. So I would much rather take these steps carefully, have a regular check-in, do them together as a county, than rush just to score points and say, look, we opened everything up. The last thing I'll say is I know this isn't just about politics for people, this is about their livelihoods. So wherever we can stretch and remember there are people suffering and they don't have money and they need to pay their rent and feed their families, that's also what guides me, together with saving lives. And so yes, to answer the question succinctly, of course, I'm concerned about opening up too soon, but I'm confident that what we've built here is the right coalition to march together, and I look forward to announcing that together with my county colleagues later this week. Thanks. Next question.
Next, we turn to the line of Erica Martin with KTLA. Please go ahead.
Hi, good evening.
Hey, Mayor Garcetti, thanks for your time.
Always.
I have a question related to to private gatherings. Aside from businesses and open spaces reopening, when do you think people would be able to gather in groups 10 or smaller again,
Sure.
behind closed doors?
Yeah, I think that's a thing that public health professionals have told us that, as we go through, I don't like really the term phases or stages because it implies you're always going to be moving forward, and sometimes we're going to move forward, sometimes backwards, so I'll call it levels for now. But in each one of these levels, level 1, we're not permitted to be together at all. Level 2, there's guidance that maybe no crowds more than 10 people. When you get to the third evolution, maybe you can get to folks who are 25 or 50. So those are the sorts of numbers I hope that the county can advise us on, that we can give the feedback to, and we can come to some sort of agreement this week. So when we get together as a group and share that, we can put that forward. But there's no question that I do believe there's safe ways to be able to do that. We've shown that. People who are working together now have shown how to do physical distancing, but none of these rules work if we don't adhere to washing our hands, wearing our facial coverings, practicing physical distancing, even as we're allowed to come together. So I'm confident we can take those steps, but I'm only confident that the steps will succeed if we all adhere to that guidance. So I hope, as I mentioned in the last question, later this week, we'll be able to announce some of those things together with Los Angeles County and other cities here in LA. But I do believe that will be a part of the next step. Thank you. Next question.
And next we turn to the line of Mary Beth McDade with Channel 5 News. Please go ahead.
Hey, Mary Beth.
Hi, Mr. Mayor. How are you?
I'm good, thank you. You?
Good. So just to follow up on a question, I forget who else asked it, but to follow up on it. So, with it being said that I know we can't open everything all at once too quickly, it would be too deadly. But what I'm confused about is, right now we can go pick up food curbside safely. Why don't you see us not being able to pick up flowers or books curbside until at least May 15th? Why not this Friday?
Well, as I mentioned, we have half the deaths in the state and we're 25% of the population. So we have to be careful. Food has been done, well, let's be clear, with some risk. There's always some risk because that's really essential. I think even above a book or a flower. But would I like to see flowers delivered to mothers this Mother's Day? Absolutely. Am I talking to public health professionals about ways we can do that? Absolutely. So I do have confidence that we can, but each one of these steps will come with risk. And with risk means further spread, and with further spread means more death. Unfortunately, we're in this really difficult place where I don't believe we can throttle this economy to death so that we'll never recover and people suffer so greatly. And we can't throw the doors open too quickly where people die in our hospitals and we double, triple, quadruple the number of deaths. But in between that, we have to recognize the uncomfortableness of living in a place where we will do things. It won't just be like, see, told you so, it was successful. It will be, in most cases, a little bit more infection. And some of those infections will lead to more death. So these are really, really tough decisions. So for me, I don't think a week is the difference. I want to make sure we get the sign-off. Today, we don't have those sign-offs from our county public health, and I won't move forward unless we do have that sort of agreement. I think it is the wrong step for any political leader to decide on their own that they know better than the doctors. Sometimes we'll have to use our judgment, and doctors will just give us advice. They won't prescribe absolutely open or close. But right now, I think we have a really good working relationship. We're getting good advice. And I do believe that whether it's this coming weekend or 2 weekends from now, we'll be able to move forward, not just with things like retail, but hopefully some of our recreational spaces. We've showed manufacturing can work with the facial coverings. We need to scale that in, I believe, in the right way too. And if we do that successfully, because we will never know in the first few days after we do something, it literally takes 2, 3, 4 weeks before we see the indicators. Is this spreading again? If it's not, you can hold if it's going up a little bit. You can proceed if it hasn't gone up at all. Or if it does go up in a worrying way, we might have to sometimes rewind and move backwards. But that is the framework. And I'm really glad you asked this question because I know it's confusing for folks out there. It's like, you got the federal guidance, you've got state guidance, now the city and the county are working on it. I want to be really clear that this is going to be longer than just a couple weeks. That is, there isn't a giant reopening. This is a series of steps and steps that we have to assess each time. And they will succeed more if we practice the prescriptions that are given to us. Wash your hands, facial coverings, physical distancing, and for our businesses, the safe practices that we're developing right now. And I'd rather have those spelled out really well than say, go open and irresponsibly see spread. So I think we're getting close, and I won't worry about whether it's 2 or 3 days or 7 days apart. We will move forward. Thank you. Next question, please.
And our final question is in Spanish from the line of Abel Alamillo with Telemundo 52. Please go ahead.
Buenas tardes, Abel. Good evening.
Buenas tardes, alcalde. You just mentioned that Los Angeles may partially reopen in a different time frame than the rest of the state. Do we know what that time frame looks like? Is it days, weeks, or months from now?
Sure. I'll say it in English first because I think it's really important. I want to be clear because I know there's confusion. People think that because the governor said you can open on Friday, that the whole state will open on Friday. That's not what the governor said today. He said counties can and should assess on the ground where they are and determine whether they should take those steps on Friday or, because they're permitted to, whether they do that at a later date. What I've been working with our county officials on, my fellow mayors and city council members across the 88 cities, is the date that was given to us by the county and in agreement with our order of May 15th. So that's a 1 week difference from what the governor announced today. We put a lot of work in preparing for that day. I don't think that we'll take many steps before that, but it is possible they could advise some baby steps before our small steps. So this is really a matter, I think, of a little bit over a week, May 15th, and adhering to that and making sure we continue to see those numbers. As I mentioned on Friday's press conference, we had more cases last week diagnosed than the week before. Now that could partially be because we're expanding testing. So then you look at deaths. We had more deaths last week cumulatively than we had the week before. So let's see where we are this week to see if there's a trend, not just of flattening a curve. Flattening often means still the numbers are still going up. Can we level off those numbers and have the confidence? And I think by May 15th we'll know that. So en español también, el gobernador no tuvo una prescripción para el estado de California hoy, pero él ha permitido los condados y ciudades de California a expandir, reabrir su economía y sus espacios. Pero es muy importante porque sus palabras fue exacta. Cada condado, cada ciudad deben accesar la situación en su área de California y luego tomar los pasos, hacer las decisiones que son específicos a esta área. Los Ángeles ha tenido mitad de los fallecieron en el estado y solamente tenemos un cuarto de la población del estado de California. Es doble nuestros números en comparación al nivel federal. Tuvimos mucho éxito en estas semanas pasadas, pero es importante mantener el progreso aquí en Los Ángeles y por eso probablemente no tomaremos pasos esta semana, pero en el 15 de mayo, cuando nuestro orden tiene un deadline, tiene una fecha específica por el condado de Los Ángeles. Pero es posible en nuestras conversaciones entre las ciudades del condado de California, el liderazgo del condado también, o tomar pasos pequeños esta semana también. Pero es mi expectación, el paquete de pasos más grande será en el 15 de mayo. With that, I want to thank everybody again who has tuned in. This will be a big week. I look forward to standing with the county and my colleagues to announce, hopefully, the work that we will be moving forward in on the framework of how we can begin to see some steps forward and also what we will do specifically in specific industries and spaces. That will be forthcoming, hopefully in the next couple days, and we'll stand together, moving together. In the meantime, I just from the bottom of my heart want to thank you for what you have done to save lives and what you are doing to keep marching forward together and not divided. With that, let me turn to Spanish and give my talking points this evening in Spanish. Muy buenas tardes, Los Ángeles, y gracias por venir otra vez. Feliz lunes. Hace unas horas recibimos pautas del gobernador sobre cómo los condados pueden avanzar hacia la reapertura. Estas pautas permiten que las localidades tomen decisiones basadas en los datos locales. Y aunque las acciones de nuestro condado han logrado salvar vidas, tenemos más de la mitad de las muertes en el estado y por eso es posible que tomaremos más tiempo para abrir de nuevo una semana adicional. No abriré la ciudad de manera imprudente. Lo haremos poco a poco siguiendo la ciencia y los hechos. Y por eso les comparto los datos de cada día. Hoy hubieron 568 nuevos casos en el condado de Los Ángeles, llegando a un total de 26,217. En la ciudad tuvimos 225 nuevos casos, llegando a un total de 12,525. Y hoy supimos del fallecimiento de 28 personas más en el condado, llegando a un total de 1,256 almas que nosotros hemos perdido. Y oramos con todos quienes han perdido un ser querido en esta crisis. En nuestros hospitales, nosotros nos quedamos muy fuerte. Tenemos 1,276 camas disponibles. Entre ellos, 235 están en las unidades de cuidados intensivos y tenemos 1,113 respiradores disponibles también. Hoy tenemos la capacidad de hacer pruebas a 18,500 personas al día. Y para el final de hoy, habremos hecho pruebas a 194,000 personas en estos sitios. Y hoy estoy anunciando la apertura de 2 sitios adicionales para pruebas en Northridge y Baldwin Hills. El miércoles empiezan haciendo pruebas en los 2 sitios y ahora hay disponibilidad para hacer una cita. Además, el miércoles empezaremos a extender las horas para hacerse una prueba hasta las 5 para permitir más personas que se hagan la prueba. Puedes hacer una cita en la página coronavirus.lacity.org/testing o llama al 213-978-1028 o al 311 después de las 5. El hacer pruebas en los hogares de ancianos es muy importante debido al alto riesgo que tienen sus residentes y es una prioridad para mí y el trabajo de la ciudad. Por eso lanzamos el equipo móvil de pruebas y requerimos que ellos proveen pruebas gratis mensuales para sus empleados y residentes. La ciudad ha hecho pruebas para 7,100 residentes y personal de tales hogares de ancianos. Y hoy estoy actualizando mi orden, obligando a los sitios de enfermería diestra en la ciudad de Los Ángeles que entreguen avisos escritos para residentes y empleados, indicando la última fecha que se ofrecieron las pruebas y la próxima fecha que se ofrecerán de nuevo. Además, hoy estoy anunciando que hemos garantizado la colaboración de un hotel en el centro de Los Ángeles para brindar más de 460 habitaciones para alojar a personas sin hogar. Si te quieres unir a este esfuerzo, visita la página coronavirus.lacity.org/rooms. Además, nos hemos unido con Everytable para preparar 120,000 comidas a la semana para 12,000 angelinos mayores. Y hoy lanzamos la segunda fase de este proyecto para incluir a más personas y unirnos con la Academia de Hospitalidad para contratar a 106 empleados para preparar estas comidas. Y estamos colaborando con 3 compañías de taxi para desplegar a 50 choferes esta semana para entregar estas comidas. Este es una cosa buena no solamente por los trabajadores, pero por nuestra población de personas de tercera edad y también por la salud de nuestro condado. Si eres mayor de 65 años, llámanos al 213-263-5226 entre las 9 y las 5 o visita la página coronavirus.lacity.org/senior meals. Además, si eres un restaurante y te interesa participar, puedes registrar en la misma página web. Les recuerdo también a los inquilinos que le avise por escrito al propietario de su casa si no puede pagar la renta este mes. Si necesita un ejemplo de una letra y más información, nuestro departamento de vivienda tiene mucha ayuda para usted. Visita la página hcvivienda.org idla.lacity.org. Finalmente, esta es la semana de aprecio.